and Dr. Drew. LoveLine, coast to coast.
It's LoveLine. I'm Adam Carolla. That is Dr. Bruce filling in for Dr. Drew. Dr. Bruce is a board-certified physician, addiction medicine specialist, and does emergency medicine, so he is on top of his game.
What are you laughing at?
I'm laughing because Bruce said before the show, well, tomorrow when I come in, I'll bring some coffee. And I said, oh, Christ, you're coming in tomorrow? And he said, and Tuesday. And I almost fell off my chair. And he said, thanks for boosting my self-esteem. No! But seriously, the reason you are here, Bruce, is because you bring a thermos full of your wife's rocket fuel in here, and I notice you've dropped the ball on that. I'd appreciate you getting back with that, because, again, that is the reason we select you over other doctors.
I was testing my value, I thought maybe by now it's more than the coffee.
No, not a good idea. Not a good idea. Dr. Bruce, Dr. Drew is in Washington, D.C., and allegedly speaking in front of Congress.
Really?
That's what I hear, and that's tomorrow. And I don't know if it's covered on C-SPAN, but I hope somebody shows up with a video camera, because I'd like to see all those people napping while Drew talks.
I'd like to get a Dr. Drew, whatever you call him, soundbite in there without him knowing it in Congress.
Out of context, Drew drop. And by the way, I didn't know they let qualified people speak in front of Congress. I thought it was only models and celebrities. Hollywood types. Yeah, I didn't know they actually let people know what they're talking about speaking in front of Congress. Anyway, I should tell you now, because it's 10 o'clock and because it's Sunday night, the Man Show is on right now on Comedy Central, and this is the best of. This is huge. Oh, this is no cop-out. You know these other shows where they do like a best of thing? It's kind of a cop-out. They didn't feel like writing another show. This is from the Playboy Mansion, and this is all the best bits. It's like out of the 100 best bits, we narrow them down to 7 or 8, and that's what you're going to see tonight. It is tremendous.
So you want people to listen to this and watch, because I'm sure you would want them to turn off this fine.
You just leave the radio on, turn it down a little bit, and put it on the Fabulous Man Show on Comedy Central.
Maybe we should
recommend.
That's right.
Maybe we should recommend tuning into drdrew.com instead.
No, there's nothing going on there. He's in Washington, D.C. He's banging a page right now. Are you kidding me? All right, you ready to go to the phones, Bruce? I do like Bruce. Bruce is a good time. Bruce has hobbies. That's what I like about him. BG? Hey, you're 20.
Yeah, hey, yesterday, wait a second.
Turn the radio down there, BG.
Hey,
jackass.
Room here. Sorry.
All right.
Okay. The other day, I, masturbated excessively, 3 times, and today I feel like I have a freaking hernia.
3 times is excessively?
To me, it is.
You're 20 years old.
Yeah?
I'm 36. I peeled off a deuce this afternoon. I don't know what your problem is.
So you heard inside or outside?
Because Sunday's my people's Sabbath, so I like to, I don't go to church, but I pay tribute to my maker any way I can.
A liquid.
Thank you. A liquid homage. 3 times in the course of what period of time?
In the course of 24 hours.
Oh, how dare you.
You have to work your way.
That's
work your way.
for me. That's a lot
That's
for me.
nothing.
Work your way up to it.
Where's the pain?
It's kind of on the right side of my abdomen.
Yeah. That's not from, I don't know. Here's the thing about masturbating. Here's what I'm going to say. You can do injury to yourself, not from masturbating, but you can injure yourself from masturbating and or sex, not from the act itself, but it's that if you were doing sit-ups, you would have stopped. You know what I'm saying? If you were jogging, you would have stopped. If you're watching TV, you would have got up and moved. Do you know what I mean? But the point is you're distracted and it feels good. It's kind of how you injure yourself when you're drunk. You don't feel pain quite as much. You have some ideas about doing some stuff without stretching out in advance. I've pulled a calf muscle or 2. The point is if I was doing sit-ups, I would have stopped halfway into it. I'm not if I'm getting it on.
Okay.
See what I'm saying,
Let's
Bruce?
see if he's in a compromising position.
He's fine. Tim, I labeled him fine. You're 28. What's up?
Hey, I just found out my girlfriend is a prostitute.
Oh, I remember when I found that out. Bruce, remember you found out your wife is a prostitute? It's never easy. We all go through that.
Yeah.
Yeah. How'd you find that out?
Well, I found out through, some whispers from some friends, and then I hacked into her email account and found some stuff there, and then, she...
If and you ain't the granddaddy of all liars.
I don't really believe him. I'm willing to talk to him, but he's got to form sentences.
Yeah.
All right, Tim, get it in gear. Kick it up a notch. You hacked into her account, and what did the account say?
Well, it's,
Did I ask him to kick it up a gear and get it moving just a little bit?
I don't know.
Disqualified? No.
Yeah.
I'll keep Tim.
Let me ask him a question.
No. Tim, you hang out on hold for just a little while longer.
Collect your thoughts.
Possibly an hour and 15 or 20 minutes, but maybe it'll only be 6 or 7 minutes. And then when we come back to you, you rattle off your answer or your question. We'll just get it moving. That goes out to everyone. Lorraine,
Yeah?
you're 17?
Yeah.
What's the problem?
Okay, like 2 years ago I went out with this guy, and he was like my first. And it wasn't the thing that he left me right after, it was the thing that I had handed him a condom, and he didn't use it.
Well,
And-
maybe he used it later on with another one of his bitches.
No, I don't know about all
Let's give
that.
the guy credit.
But,
You gave him a condom, he didn't use it.
yeah, exactly. He didn't use it. And now I'm like disgusted whenever I'm with a guy. I mean, I don't have sex with him. I mean, even if I'm just kissing me, it just disgusts me.
How long ago did this incident happen?
2 years ago.
2 years.
When you were 15, how old was he?
He was 17 and a half.
Yeah, and do you feel like you were in love with him and he broke your heart?
No, it's just that he disgusted me. At first, yeah, I cried and cried, but I was more afraid of getting like a disease.
Well, that's how long had you known him before you had sex with him that time?
A month.
Okay. I think the lesson that you should learn from this is maybe a different way to approach relationships. Get to know the guy maybe a lot longer before you decide to have sex with
A
him.
month when you're 15 is like a year and a half when you're 30. I mean, dog years. That's plenty long.
Yeah. This guy,
Think about how long that period was from November to the time you broke for Christmas break when you're in the 10th grade.
Right.
All right, that's plenty of time.
Don't you think you would have figured this guy out if you'd waited longer? You would have seen signs that he was a dirtbag?
Yeah.
All right, but Lorraine, here's the real question. Why are all men bad? How come you're so screwed up over one bad outing? What's going on with you?
What do you mean exactly? At home?
All right. What's going on at home?
Oh, well, my parents are getting a divorce.
Yeah.
My dad was a really abusive guy.
Yeah, your dad's abusive. All right, so that's probably why you think guys are yucky.
Oh.
Had you connected that before? Had you figured that out?
I kind of thought about it after a while, but I didn't think, right away. I didn't try to put 2 and 2 together.
Let me tell you something, Lorraine. This is very important, and it's very important for guys to listen to this, too. Men are not horribly affected by their relationship with their mothers. They are to some degree, but it's just not that much. They're a little more durable. Maybe that's just because they're a little more thick-headed. They have a reptilian brain. Not that much gets through. But women, the relationship you young girls growing up have with your daddy is paramount to the way you're going to look at men for the rest of your life and all your relationships with the opposite sex. Don't let it run your life. Your dad's an a-hole. He was an abusive. That doesn't mean you got to hook up with an a-hole. And it doesn't mean you have to be freaked out by guys. There's a lot of good guys out there. Unfortunately, your dad bent your antenna, and you may not be attracted to those good guys. But work on that, and you'll be attracted to the good guys, and then you don't have to worry about it. Not every guy is your dad. Actually, only 3 guys are your dad.
Okay.
Yeah.
And just
I'm not
knowing
going to tell you who they are.
Just knowing what Adam told you isn't going to solve your problem. Really, you need to go to a counselor and work through some of this stuff.
Okay.
Did you go get a pelvic after you had intercourse with
Yeah,
the
I was fine.
guy? Okay, good.
All right.
Talk
Lorraine,
to somebody.
You're asking questions. You're only 17. That's fine. You'll be fine.
Thank you.
All right. Just don't get pregnant.
I won't.
All right. I don't know why women, I'll tell you, you meet a woman, ask her what she thinks of her dad. If she says, I hope that son of a bitch rots in hell, you're
Run.
screwed. You're screwed. You're screwed, guys. And there's no way of getting around it. You just can't get around it. And if they love their daddy, not too much, but they have a healthy respect and love for their daddy, you're in great shape. And if not, you're effed. You just are. Understand that. Ask it on the first date.
How many girlfriends have you had that love their daddy? Healthy ones. Be honest.
How many healthy
Girlfriends have you had?
Well, first off, any girl who loves her daddy will be healthy.
Right.
So you're asking kind of a non sequitur there, or kind of a oxymoron or something. You know what I'm saying?
How many healthy girlfriends have you had?
Probably had 2 or 3.
Oh.
And the ones that love their daddy love you, and the ones that hate their daddy, they love you real hard for a while, but then they go south. And because you are their daddy. Matt?
Hello?
You're 14.
Hey.
And for you girls, you don't become the guy's mommy unless the guy's Jewish. And then it's mommy and grandma. It's Nana and mommy. Matt, what's up?
All right. A week ago, I was at a party with my friends, and we were just screwing around and riding on the back of a car, and I fell off and cracked my head. So I have a 3-inch fracture in the back of my skull, and I was in the hospital for a week. And now I'm out, and I feel fine, and I'm wondering how much smoking pot is going to affect, like, the healing process.
It could leak out of that crack, right? Is that what you're asking? You got to wear a hat.
No, it didn't break the skin.
Oh.
It cracked the skull.
All right. Bruce, I know you're going to chime in with more of your nonsense, but
No.
here's the reality. You already rattled your brain and you're 14. Just give it a little rest.
Really?
Well, it's not like the bones aren't going to mend because you got THC in your system. It's more like you're 14, you're stupid enough to be riding around the back of a pickup truck surfing while the guy's going 35 around a corner and you're holding a wine cooler. And now you're going to put pot on top of that. You do a few years of that, and by 4 years from now, when you're 18, you'll be all ready to move into your parents' garage and get yourself a job at the Arby's.
How much were you smoking before this?
Not that much, just a little bit every once in a while.
Okay, well, the thing with a fractured skull, any kind of head injury, a concussion, you don't have to lose consciousness. When you hit your head, there's a lot of stuff that goes on inside the brain that's not good. It takes time for a lot lesser injury to heal up. So smoking pot and scrambling your brain synapses more, it's just going to take longer for you to get your thinking back straight. You may feel like you're back to normal now, but marijuana has a lot of effects in terms of your cognitive abilities. And
Bruce, you're not a pot guy. I can tell you're not a pot guy. You know why? Because you're one of these guys that gets weird and paranoid when you get high. You know why? You're a sugar guy. Sugar guys aren't pot guys. I mean, you're a sped up guy. Pot guys get into sugar after they get high, but you're you're a speed up guy.
You base this on extensive.
I know. Listen, I know the personalities that match up well with the weed, and you're too sped up. You're too skizzy as it is. You're like a greyhound or a whippet. You know what I mean? They don't need weed doesn't work well with those personalities. You freak out when you get high, right?
No.
Really? So
I smoked in high school.
Are you high now?
No. Unfortunately, I think it might. But when Snoop was here that time, I think.
You got a little contact
that
going.
was really quite.
Bruce just asked Danielle, our phone screen, to get him a coffee, and he said, and I quote, put 10 sugars in it. And he was deadly serious. He wasn't kidding around. Like, when's the last time you heard a guy order a cup of coffee and say put 10? Well, actually, he's cutting back. Put 10 packets of sugar in. Now, if you were sitting at a coffee shop with this guy, you'd start laughing, right? If he said that to a waitress, you think he was screwing around? You're dead serious, aren't you, Bruce? You gonna come in with your Coke analogy?
Yes.
Yeah,
Very
okay.
good.
Shut up. What do you mean, excellent? I got to be Kreskin to figure out your crappy rap? You got 3 analogies.
Forget Kreskin. You never address that. You drink a Coke, you got 12 teaspoons of sugar in there. You sit there going, wow, look what I'm doing. I'm drinking.
Well, first off, I wouldn't drink a Coke past 10 o'clock at night just because of that. And I don't drink a Coke.
Puts me to sleep.
Right.
Let me tell you, I was reading a study last night. There's no correlation with sugar and attention deficit disorder or any of this other stuff.
I know. It's all BS.
My teeth are falling.
I had to grow up in the 70s when everyone became hyperkinetic, as they called it back then, because they ate too much sugar.
Right. That's what they blamed your behavior on?
I'm going to sue my mom. No, my behavior. I want to take a nap. Ryan?
Yeah.
You're 20. What's up? Sorry to disturb you.
Okay, well, no, sorry. Basically, for a little history, I was a virgin just up until a few months ago.
Mm-hmm.
And, the first couple times were fine, but I've been having a little trouble keeping an erection.
I see. So the first couple times you had no erectile difficulty?
No.
Who was this with the first couple times?
It's with my current girlfriend. I've known her for about 4 years, and we've been going out for about 6 months.
I see. Went out for 6 months. Now, why were you a virgin to the ripe old age of 20?
I don't know. I never really had a long relationship with anyone for a while.
All right. So you're not freaked out about sex. It's not a religious thing. Just timing.
Yeah.
Okay. You're one of the have-nots in life.
And you have no medical problems, no diabetes, nerve disorders, back injuries. Okay. So the problem is there's got to be some anxiety somewhere. There's some insecurity in the relationship. There's something going on because you don't have erectile dysfunction at your age if you're healthy. So
the thing I can't figure out is it worked out the first couple of times?
Yeah, it did. I mean...
He's had time to think about the whole thing.
Yeah, it did. And, it was fine. And then, last few times, basically for the last month, I've been having problems.
Okay, so the first 10 times you did it, the penis worked fine? Cooperated?
No, the first
2 times.
2 times.
Okay, well, you said few or couple. I didn't know if you were talking about a couple of weeks or just 2 times. So the first 2 times went swimmingly. Good erection. Kept it for how long?
About 10, 15 minutes.
All right, and everything was good, and then the third time, couldn't get it up.
Yeah.
Okay, hold on a second. That's bizarre because usually when you have a few successful outings, it breeds success.
Right.
Especially if you're a virgin, you get a little bit of a late start, certainly by LoveLine standards. He's about, he's 20. He's about 10 years late, and that's for the ladies. For the guys, he's 13, 14 years. Our average age of male losing his virginity is 6.5, and that's white males. The Latino and black ones are down at 3. I think 3 and 3 months.
So
I
you're
haven't
not
checked it yet. The
you're
point
not used
is
to dealing with these.
The point is he's got no medical condition. What the hell happened?
Because he's only had
number
sex,
3.
Only had sex twice, and so if he'd had sex for years and he couldn't get an erection or something happened, it wouldn't bother him. But he's now anxious because.
All right. Where did it come from, though, Ryan?
Yeah.
What did anything change with your girlfriend?
No, not really. As far as the relationship goes, it's been going great.
Is she more experienced than you are?
What's that?
Is she had more experience than you?
Listen, the flip-flop I'm wearing has more experience than Ryan has. What, are you kidding me? Are you thinking about that or something?
It doesn't, we've been like best friends for a while, and it really doesn't matter, or it doesn't really bother me, but...
Right. Okay, listen, Ryan.
Yeah.
Do you not get an erection, or do you lose the erection halfway into it?
I lose the erection halfway into it.
And can you get it back?
Yeah, I can, but it's really fleeting.
Yeah. And can you talk about it with her?
I haven't really. I don't know if I'd feel really comfortable talking.
Yeah, but here's the thing. You're naked and your penis is blowing in the wind. You might as well bring it up.
Yeah.
You know what I mean? It's not like you're sitting at the debutante's ball and she asks you to pass the chickpeas and you bring your penis up. Yeah, you're naked. You were just inside of her or inside somewhere, and now your dork is not cooperating. Go ahead and talk about it.
Well, he's dealing.
I think he needs to take the pressure off himself.
Right.
If it happens again, figure it out, work with it. You're a couple. You guys known each other for a long time. You're friends for a while. Talk about it.
Right.
That's fine. You take that pressure off. If you go into the event with the sort of attitude of, hey, if it happens, it happens, and we'll work around it. And if it doesn't, great. You take the pressure off. Magically, it'll work. Right? Danielle, you watching the Fabulous Man show in there? Comedy Central, 10 o'clock. Is it from the Playboy Mansion? Oh, yeah. That's some good comedy going on.
Yeah, whatever.
Excellent comedy. Now, where are we? Because I want to come watch it. Are we going to a commercial, or what's going on over there?
In wrestling school right now.
Oh, I'm at wrestling school.
I'll just do
All right, I'm going to go watch that. We're going to take a little break. Dr. Bruce filling in for Dr. Drews. Hasn't talked much, so he's doing a great job. We'll be back after this.
Call on the 1-800-LOVE-191.
This is LoveLine on Outrageous Talk Radio, 100.7 The Buzz.
Hey, LoveLine. I'm Adam Carolla. That is Dr. Bruce filling in quite nicely for Dr. Drew. Just watching some of that fabulous man show on Comedy Central. Boy, is that show funny.
I'm not sure it's as funny as you and I here, though.
This is more pathos than it is comedy.
Okay.
Phone number 1-800-LOVE-191. Bill Bellamy will be in here tomorrow. One of the folks who managed to escape MTV and move on to a pretty nice career acting.
Is that what you're going to do?
No, not me. I'm getting back into construction. Thank you. Fred?
Yeah.
You're 25. What's up?
How you doing, Adam?
Good.
Just want to say hello to Bruce and Anderson as well. I got a problem. I have discoloration of the foreskin on my penis, being I'm dark complected.
Yeah.
Kind of eye-catching towards my sexual partners.
Yeah, the guys don't like it, huh? No, it is nature's little joke. The darker your skin, the more that... Now let me ask you this, Bruce. Why does it seem to show up on the dark penis more than it shows up on, let's say, the dark forearm? You know what I'm saying? Yeah, I mean, it's an interesting question. I mean, you take like a black guy, right? Mm-hmm. And he gets a cut, let's say, on his bicep, and then it heals black. You don't have a white streak going down the side of his arm. You know what I mean?
Right.
Maybe you get a little keloid action, but it's dark. Mm-hmm. But then somebody screws up with the circumcision, and the guy's got a white halo going around his penis. What's up with that? Is that what you got, Fred?
Yeah, it's also on the very tip of I guess the head of my penis.
Yeah.
It's discolored white as well, and I know I was exposed to one of my ex-girlfriends years ago. Told me she had chlamydia, I think it was.
Yeah. I don't think that would do it. Here's the point, Fred. This is just God punishing you for something, and there's really nothing you can do about it. Bruce, there's nothing you can do about it.
You are circumcised?
No, I'm not.
You're not. Okay.
Oh, he's not?
No, he's not.
Well, that's interesting.
Yeah.
Because he's usually circumcision scar.
Right. Now, is this something that's changed recently, or that's the way it's always been?
I'd have to say within a few months it's developed. At first, I didn't really pay much mind, but it's pretty obvious now.
Okay, so you have increased pigment in that area? It's darker?
No, it's lighter.
It's lighter in that area.
I mean,
okay.
Very, very light.
All right, there are things that can cause your pigment to change in your skin. And nowhere else in your body, have you ever had that happen?
No.
Nothing recently. And the thing to do is just go to your doctor and have him take a look at it, because the way it's shaped, where it's located, there are fungal infections that can cause changes in the way your skin's pigment appears. But it's sort of an interesting complaint to have that.
What?
The darkness of his, that's a cosmetic concern. I haven't...
Well, first off, women, they prefer the lights be off anyway, so you could shut the lights. Secondly, you could use the condom I use, which is black and has horizontal stripes to make my penis look wider. So that's number two. But three, you hook up with some chick, you hang out with her for a while, she doesn't care. Women are much more forgiving about that kind of stuff than men are.
Right.
You know what I mean? Plus, whatever penis you got, they just assume all of them are that way.
People have tattoos there.
Well, yeah, that's a different breed of cat. Oh. Michelle?
Yeah?
You're 16?
Yes.
What's up?
I take my friend's Adderall. It's attention deficit disorder medicine.
Right.
And I take 4 instead of taking 1, and it makes me all hyper and kind of I don't know. Really,
is that
really
speed that? It's weird that they combat speed. They combat sort of hyperactivity with speed.
Yeah.
And I don't know why that works.
Because, first of all, the Adderall is a mixture of amphetamines, and it creates a a long-acting form of amphetamine.
But it's speed, right?
Yeah, speed is methamphetamine. That's amphetamine. So you're basically
What's the
taking...
difference between methamphetamine and amphetamine?
In essence, there's no real difference.
All right, well then stop making it sound like there is.
Okay.
One you snort, the other you get from the doctor.
Yeah, there's really no difference between going out and buying speed in the street and what you're doing.
It's the same term. It's the same like long-term effects and everything. Like.
Well, here's the deal.
Right.
Here's the deal, Michelle.
Yeah.
Speed is one of the ugliest drugs.
Yeah.
It is really super ugly. I mean, you ever see people that are strung out on speed?
Yes.
They're the ugliest people there are. They're really, it's really an ugly, ugly drug. And you're 16, honey. Mm-hmm. It's not going to look good for you. Well, I mean, can you slow down with this?
Yeah.
You can? Can you just stop it?
Yeah.
You think so?
Uh-huh.
Well,
Does she know you've been taking your pills?
Yeah, she gives them to me because she doesn't like taking like stuff. The stuff that doctors give her and stuff. She doesn't take her manic depressive or her like antidepressant medicine, so she just gives them to me.
What color are pills?
They're blue.
Okay, so she has 10 milligram Adderalls. And have you been doing this every day for a while?
I do sometimes so I don't eat. Sometimes it doesn't make me eat. And
Are you overweight?
No.
Okay.
Hey, Michelle?
You have a family history of addictions anywhere?
Yeah, my dad was a heroin addict.
Yeah. Michelle, listen to me.
Yeah.
Why don't you just belt out a couple of kids right now, punch yourself in the face so you get a nice black eye, knock a tooth out, put some track marks on your right arm, and move into a goddamn trailer. Just do it now. Just save yourself. I'm going to take the next 4 years and condense them into 4 days. I want you to just take a needle and poke a bunch of holes in your right, the inside of the elbow there. Give yourself a black eye. Pull some of your hair out, knock a tooth out, lose 20 pounds, and move into a trailer. And use a rope to hold your pants up, and make sure you have a couple of kids that get no attention. Because I'm telling you what your life is now.
And I'm impressed that
what it's going to be.
Yeah, I'm impressed that you called. I'm happy that you called, but I'm concerned that you're going to have a harder time stopping that stuff than you think. Okay.
And I have another question. Would it like make my period be like weird if I've been taking that stuff? Like, it affects your period, right?
Yes, that's right. Snake blood will come out of you for 1,000 days and 1,000 nights.
Yeah, it affects everything, and just the way you're eating on it, and your sleep's got to be messed up. That when you have attention deficit disorder, you have not enough dopamine in areas of the brain that are like where you put the brakes on for things.
Mm-hmm.
So your brain's going faster. And yet, when people take Adderall, they're taking a low dose just for instance, you're taking 4 of them. The person that takes one of those 3 times a day, that's not like snorting a line of speed. What you're doing is you're taking a large dose of the stuff, and do you drink? Do you smoke pot? Do you do anything else?
Oh, yeah.
Mm-hmm.
Michelle?
You do everything, baby, right?
I don't do everything. I smoke weed occasionally.
Right, yeah. But you're 16. Your dad. I mean, you've got the genetics for you have the disease.
Let's be fair. Her dad was only into heroin. It's not like he was a hardcore drug user. Hey, Michelle.
Yeah.
You need to go to some like Alateen and stuff like that.
Well, maybe she needs to go to...
You need to start working on your sobriety at the tender age of 16.
Yeah. Do you know anybody that's a counselor that deals with addiction problems?
I go to like counseling and stuff, but my mom made an appointment and another appointment. It's not until a while because it's busy or whatever.
Yeah. Don't you think she should go to like some Al-Anon meetings or something? Because
not
Al-Anon. Was a junkie.
Yeah.
Well, what?
My parents got a divorce when I was 5 years old.
All right, hold on a second. What meeting?
Alateen is fine. Whatever meetings.
Didn't I say Alateen first?
Wait, yeah, and then you said Al-Anon.
All right.
Okay. Well, fine.
Not Al-Anon. What shouldn't she go to these meetings because her dad was a junkie?
Yeah. Well, she's already an addict. I mean,
all right, but she needs one for her dad, and she needs one for her.
Right. You're right, Adam. That's fine.
Okay.
But she needs to get professional help. Well, because I think she's going to have a harder time quitting than just going to 12-step meetings. I think she needs some other help. So.
Hey, Michelle, start taking care of yourself, will you?
Oh, okay.
You got to stop doing this.
All right.
You understand me?
I understand you, Adam.
Listen to me, you screwball. And listen to me, all you screwballs out there. The people I knew who were in high school, who were F-ups when they were 16, I see them now, 20 years later. And here's the deal. Some of them are dead, and the ones that aren't are still F-ups. And life sucks as an adult when you're an F-up. When you're a kid, you're just a rebel. You're just whatever. Hey, you're troublemaker. You're a fire starter. You're whatever. You get older, you start getting ugly, and you don't have insurance. Life sucks. So start taking care of it now.
Yeah.
Would you please?
Yes.
All right. I'm telling you, everybody, it's great to be an F-up when you're 16. You just look cool. Girls are pretty and guys are cool. You turn 31, ladies, and you're still an F-up, you're ugly. Because you age fast when you're an F-up, and life sucks. It sucks to be an adult and not have nice stuff, not have insurance, not be able to take a vacation, not have a life.
Yeah, but you're right with speed. It's a horrible drug because the person thinks that nobody knows they're doing it and everything's going great, and everyone around them knows, and things are falling apart, and they can't see it.
Michael?
Yeah.
You're 14?
Yeah.
What's up?
No, man, I just want to know, like, what's the long term, and even if there is, in terms of masturbation.
Long-term effects of masturbation?
Effects.
Well, short-term effect is something comes flying out of your penis.
Yeah.
That's short-term. And then long-term is you want to do it later on after you're done? No,
they're
nothing.
Sources of information from long time ago.
Go ahead.
Say that it causes cancer.
Go ahead, Michael. You're fine. What are you good for? What are you good for a day?
Huh?
How many times a day?
5, at least.
Oh, at least?
At least 5.
So
Okay.
what are you concerned about? What'd somebody tell you? What?
That like, if you jack off a lot, that, like, somehow, some way you could catch, like, viruses.
No. I'll tell you, when I'm in charge, I'm just going to put a homing beacon on all these guys and sterilize them. I really am. Thank God he's masturbating like a ferret on a double cappuccino and has no time for the ladies. Jesus Christ.
Okay.
All right. Nothing's going to happen.
No.
You keep doing it and don't have any kids. Melissa?
Uh-huh.
You're 32?
Yes, I am.
What is up?
Oh, I met a guy. I knew him. This is crazy. I met him for a month and a half, and we took off to Reno and got married. Okay, that's not the problem. Last month, we've been married since July. Last month.
Hold on, baby.
He's been.
Hey, hold on. Are you doing coke or speed or
taking her
something?
friend's Adderall.
Nothing.
You're just nervous.
Yeah.
Okay.
He was in psycho ward for 14 days last month.
Well, what specifically? I mean, there's...
What happened?
What's wrong with him? Psycho's not a diagnosis.
Well, okay, he
Love
flipped out and went to the funny farm for 14 days of last month.
Well,
all right, hold on a second. Let's do a little LoveLine reenactment. And I've said this many times, we have the world's dumbest callers to the show. And I'm assuming the world's dumbest listeners as well, but I can't account for all of them. But I do know we have the world's dumbest callers.
No, she's just...
Males
that's
and
her
females,
level of understanding
young
of
and
mental
old.
illness.
That's her level of... Okay, we'll do a LoveLine reenactment. I know Bruce is going to F this up. I'll play the caller. Bruce, all you have to do is play yourself. You ready?
Yeah.
He flipped out. He went to the psych ward.
But what's wrong with him? What's his exact diagnosis?
He sheared off a wing nut. Now he's at the funny farm.
What? No, funny farm is not a place. A psychiatric hospital for people with... Is he bipolar?
Cuckoo.
Have you been taking any drugs tonight?
Melissa?
Yes.
All right, baby.
I swear to God, I'm not doing drugs. He's taking all kinds of stuff.
All right.
He's taking antipsychotic medicine.
Okay, listen here.
Uh-huh.
Why did you decide it was a good idea to wing off to Reno and marry this guy after a 1-month courtship?
1.5. I thought he was the sweetest guy in the world.
Okay, so what's wrong with you?
I'm effed up too.
Yeah,
Yes.
what's up?
I just take Paxil, okay?
Okay.
Now we're getting somewhere. Hold on a second. Just because I feel like clutching my side. How many kids do you have?
I have 3 that live with me and 2 that live with their dad.
Hold on. Oh, my side. Oh, my side hurts.
I know, all the...
Hold on. It feels like a rusty sprinkler key has been shoved into between the 2 and 3 rib here on my left. Hold on, baby. Hold on, I gotta take a break. I gotta go vomit, crap, and squeeze one of my eyeballs so it pops out of its socket.
So, Melissa,
hold on, Bruce. We gotta take a break. Oh, my side. What is that? 6 kids? 6 goddamn kids from Nurse Ratchet over here.
I think you're enlightening her with your role playing here. It's really instructive. It's 5 more listeners.
Hold on, though.
5 more listeners for the Man Show.
I'm sure she's a wonderful parent. I think it's just a relationship where she has difficulty. I'm sure she's a wonderful mom.
Family night at their house is the Man Show.
My side. All right, we're going to take a quick break, and we'll be back and see if we can't sterilize Melissa after this.
1-800-LOVE-191. We'll be right back.
This is LoveLine on Outrageous Talk Radio, 100.7 The Buzz.
It's LoveLine. I'm Adam Carolla. That's Dr. Bruce, filling in for Dr. Drew. Phone number 1-800-LOVE-191. Bill Bellamy will be in here tomorrow night. He's a real nice guy, Bill Bellamy, and Italian. And I haven't seen him in a while, so it'll be nice to see him tomorrow night. I'm just watching a little more of the Fabulous Man Show on the Fabulous Comedy Central. Man, it is the best stuff from the Playboy Mansion, and there's some funny-ass on the show. Boy, I tell you, I'm proud. Melissa?
Yes.
So, you're 32.
Yes.
You married a guy who's 24. 6 weeks you knew him, and you winged on off to Reno, and you got yourself hitched.
Yes.
Now he's in a psych ward.
No, he's out.
Oh, he's out. And you have 6 kids.
5.
Oh, 5. And how many with him?
None.
None?
No, a month and a half.
He's got 2 kids.
No, they got married after a
2
month
months.
and a half. I don't know how
She
long
met him
they've
in
been
July.
together. Oh, okay.
Okay. You're lucky you didn't call one of the more serious radio therapy shows. You would have gotten slapped around.
Can you be?
You're slapping me around already.
Can you be sterilized?
I am.
Oh, you are?
Oh, yeah.
Oh, good.
He does.
Well, my last one was a set of twins, you know.
Oh, yeah. Good. I'm sure some family will adopt them and
Yeah,
do
they're
something
mine.
with them.
I love them.
You love them?
Yes.
Where are they?
They're in bed.
Oh, really? Are you really raising them?
I am really raising them.
Okay, where's the...
What you guys said about that 16-year-old girl who's effing up, I was her back then.
Oh, yeah.
And I totally related. I've done drugs for many, 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 many years.
Now, don't you wish somebody would have given you a black eye, pulled a tooth out, put some track marks on your arms, and given you a couple of twins at 16 so you could have just got the last 15 years over with?
Yeah, right.
Yeah.
No, I wish I would have gotten smart back then.
Yep.
Okay, so...
You know, I still have the same pattern.
Oh, baby.
With men. I'm reading Codependent No More.
Good. Good. When you're done reading it, eat the book, would you?
Listen, where's the new husband?
Put it in your vagina so you can't have any more kids.
She's sterile.
He's at his mom's house.
Okay, so you guys are separated or what?
I just made him give me my house key back, and I told him I want to get an annulment. He's begging me to stay.
What do you do for a living?
I just work part-time right now for a demo company. I've been with them for 4 years.
Okay.
And I just got a full-time job out at the Palace.
Okay.
Indian Gaming Center.
And you're going to a therapist and you're taking Paxil and what else? Do you have any insight from this? I mean, it sounds like you're very impulsive. You've got some personality things.
What do you do at the Indian Gaming Center?
Oh, my goodness. So shipping and receiving.
Shipping and receiving?
Yeah.
Okay, you ain't out on the floor.
Not yet.
You ain't the greeter who stands at the door and says, "Hi, how are you? Hi, how are you?"
No.
It's a little Indian joke there, everybody. All right, baby.
Wait.
Now, go ahead.
What was your question?
She wanted to know whether to stay with this guy.
What do I do? He wants me to go see a psychiatrist with him. He wants me to go to his therapy appointments and all this stuff, and I just keep trying to get him out of my life because, you know, bipolar and schizophrenia, it's like, you know, he's going to have that for the rest of his life.
All right, but hold on there.
Yeah.
Melissa is treating him like a lame horse that she wants to shoot.
That's how he's been acting.
Okay, he's been acting horribly.
Like crying 3 or 4 times a day.
Okay, he has problems, but you two are married, and he wants to go and work out these problems. Most guys don't want to work on their stuff. They want to get drunk
right.
and watch TV.
Yeah.
Why don't you, for the sake of the kids and the marriage, if this guy's getting some help, why don't you agree to go to a few counseling meetings with him or talk to a therapist with him and talk to the therapist about what it is you want to do and tell the therapist about your concerns.
Yeah, and you're saying schizophrenic, bipolar. Sounds like he's probably bipolar, and he had a manic episode, and he had some psychotic type of things going on with it. But you don't know these. It sounds so. If he's on his medication, he may be relatively normal.
Well,
and
listen, you know he's crazy. He married Melissa.
Well, yeah, he's not crazy. So listen, you got a lot of chaos in your life. You're very impulsive.
Shut up.
Well, wait a second.
Well, are you going to go against what I just said?
Oh,
Huh?
No, I'm not going against.
All right, well then shut up. Let's go to the next call. Go to the counselor with the guy. Give him a chance and see. Try to work it out.
Normal call.
How bad could that be, Sarah?
Hi.
You're 16.
That's right.
What's up?
Well, I can never meet guys my own age, and I go to a really big school, but I never get asked out, and I always end up with guys who are either 19, 20, or 21 in that age group, and I don't know what's going on.
What do you mean you end up with them? You mean under?
Well, I get hit on by guys who are like up to like 30,
Right.
and
You'd like to swing with some 16, 17-year-olds?
yeah,
Yeah.
I'd really like just a nice, normal high school relationship.
Yeah.
Have you had relationships with the older guys?
Yeah, like my last real boyfriend was a freshman in college.
I see.
My sophomore year.
Yeah. Are you big?
Tall.
You're tall.
Yeah.
Yeah, maybe you're a little intimidating to some of the 15, 16, 17-year-old dudes, you know? How's your attitude?
I guess I spend a lot of time alone.
All right.
Okay, did you have any...
You may be freaking these guys out.
Did you have any abuse things going on? Did you have any bad experiences with older men when you were younger? Anything happen to you?
No.
Okay, girls that mature early tend to get into more trouble. They have more problems, and it's simply because of the direction you're going with forming relationships with these older guys. That's inevitable. Apparently, you look older. Is something attractive about you to older men? There's a lot of sick older guys out there. So you've got to just, stop that before it goes anywhere. And you don't have to be in a relationship all the time. So
yeah,
you're just going to have to hang out with kids your own age. I mean, can you say no to these guys? Is there a problem there?
Oh, well, yeah. I get hit on by, like, really old guys a lot. And my last relationship was actually, like, a really good relationship, and it was in, like, April.
That was with Wilford Brimley.
No.
Okay. Hey, Bruce, have you ever laughed at a goddamn thing I've ever said? Just check your mind. Check your mind's eye for a second. I was thinking about that the other day.
Really?
Do you have no sense of humor? Do you not find me funny? Or do you actually restrain yourself from laughing at no matter what I say?
I sit here laughing quite a bit, not into the microphone, but I think you're actually pretty funny. I hate to give you any kind of great...
I'm not sure if this date's working out. It's important that you worship me. True worships me secretly.
Ooh. Oh,
that
yeah.
You worship me
oh,
too.
that's, yeah.
All right.
Okay.
You are my teacher.
There you go. I'm thinking about breaking a little early so I can go watch that man show. What do we got over there? Are we on a commercial? Anderson gave me the thumbs down. I'm not sure what that meant. We're on a commercial now, Anderson? All right. Well, we just get into a commercial or we just did?
Why don't you do one of those?
All right, let's take another call because I love the kids. Okay. Angela?
Yes.
You're 17?
Yeah.
You think your one-year-old kid is going to be a psychopath?
Well, I was with her father for a while, and right before I found out I was pregnant, he went into the mental hospital, and they told him that he was psychopathic, and they said that it was genetic. And my daughter, she's been really weird. She's been hurting, like hitting herself, and like when she gets mad, she gets really mad. I've never seen a one-year-old act like that before.
All right. So first off, thank God it's a girl so she can get into stripping and not kill people in violent ways on the street. So thank you for having her.
How did he get in the hospital? Was he hearing voices? Was he running around?
He was hearing voices, and then he threw a big brick through his grandma's window because he used to like to break things that was really expensive because his family had money. And so he went to throw it through his mom's back window of her van, but it missed, and it went through the window of his house. And so they called the cops, and they came and they took him to the mental hospital.
I'm sure he was able to explain to his grandmother that he was just trying to take out the rear window of the van.
Yeah.
And that she has them all mixed up.
Yeah.
Okay. So there's genetics involved, and then there's environmental factors. And I was just reading something else recently that was interesting. It was talking about the lack of correlation between the demeanor and temperament of an infant, a young child, and how they are when they grow up. So this is disturbing because, on the other hand, it sounds like there may have been a lot of chaos, maybe abuse.
What should you do?
Well, a good child psychiatrist, I think.
1-year-old?
Absolutely.
Really?
Yeah, I don't know, have there been any abuse issues? You're 17. How old was the guy? There's a lot of stuff here that's unknown, but...
Oh, he's not that much older than me. He's only about a year older.
Right, but I mean, it sounded like you probably had a very chaotic environment for this kid's first year, and you don't know what else went on.
No daddy around.
Well, he's not around anymore.
Right. The best thing to do, first of all, pediatricians are trained to understand what's normal developmentally, and they will be able to tell you whether or not you need to bring the kid to therapy, a child psychiatrist, but there are books.
Okay, can you sterilize yourself too, baby? Or do something not to have more kids?
No, I restrain myself from having sex. That's all I do.
Right, Angela, you sound like you're a good mom. Go to your pediatrician and share the same concerns.
All right, we're going to watch the man show. We'll be back.
LoveLine.
1-800-LOVE-191.
We'll be right back.
This is LoveLine on Outrageous Talk Radio, 100.7 The Buzz. KQBZ Seattle.
The average person uses 10% of their brain. How much do you use? 1.5%. The rest is clogged with malted hops and bong resin.
Outrageous Talk Radio, 100.7 The Buzz. This is LoveLine on Outrageous Talk Radio, 100.7 The Buzz.
Carpet remnant. Gretchen,
Yeah, hi.
you're 30. What's going on?
I have an acne problem. I've been using everything from just their household products, and I remember you mentioned something about a hardware item that works.
Oh, yeah. Well, you're talking about the time when I was 18 or 19, and I was doing a little auto body work, and I was reading the ingredients to Bondo. Now, Bondo is the stuff they use to fill the dents and holes in the side of your car fender. And Bondo has two agents, like a catalyst and a resin, and you mix them together, and they harden. Now, it's not clear, but the point is the catalyst, the thing that makes it dry.
Benzoyl peroxide?
It's 90% benzoyl peroxide. And I was reading this little tube, and I thought to myself, geez, I'm paying $5 for a thing of Oxy 10, and that's 10% benzoyl peroxide. And for $5, I can get twice as much, and this is 90%. So I put a little of that stuff on my zit.
You what?
Yeah, put a little Bondo on the zit. It didn't work.
It didn't work.
No. Hey, but Gretchen.
Yeah.
You can get, what about that Accutane?
Oh, I wouldn't try that.
Okay.
Why not?
It's not that bad, but it's noticeable.
Do you have...
Yeah, but Drew takes it.
Okay, do you have
Works fine for him.
inflammatory... Is it inflammatory? Do you have swelling, redness, or
No, but
just the pimples?
It's everywhere.
Okay. Have you used prescription benzoyl peroxide?
Okay.
Hello?
Hello.
Have you used prescription medication, or are you just getting... Okay, the prescription stuff is more effective than the over-the-counter stuff.
What percentage of benzoyl peroxide is that?
Well, it's not the percentage, it's the form.
Hold on a second. You mean the 10% benzoyl peroxide and Oxy 10 that you buy over the counter is 10%. When you get the prescription form, it's not more than 10%. It's just a more effective benzoyl peroxide?
Right. They don't...
No.
The over-the-counter and the prescription... are not in the same... there's a gel and...
right, but isn't the percentage higher?
The percentages are the same. You can get... You're right. You can get percentage-wise an adequate percentage. And
hold on.
And the stuff over the counter...
Is the prescription stuff a higher percentage benzoyl peroxide?
You start at the lowest percentage even with the prescription stuff. And
you start at 10%?
No, you'll start at a lower percentage.
5%.
2.5%.
Really? Well, why bother? Why not just kick it up a little?
Okay, let me just ask her a couple questions.
She's having trouble.
Have you used the antibiotic cream or taken tetracycline?
No.
Are you on birth control?
Shelf.
Are you on the birth control pill?
No, I'm not.
Sometimes a birth control pill will straighten it out for some women.
No, it makes it worse. There are two forms.
Not for all women. For some women, it helps them.
Well, usually doesn't help acne, but there are two new progestin forms that don't exacerbate or make worse the acne. But
Hey, I have
listen,
another question.
I'm telling you, for some
Right.
women, it clears their skin up.
This is for Dr. Bruce.
Right.
Okay, like a month ago, guy tried to fist me, and it didn't work, but ever since then I've had like a yeast infection, but the doctor said that it wasn't, there was nothing present. I have no diseases, so what's going on there?
All right.
What was on the guy's hand?
Hold on a second. What is it?
I wanted to stick with acne.
Crazy broad night on LoveLine? My God. I'm getting an erection. So she goes from the conversation on benzoyl peroxide to the other day this guy was fisting me.
Well,
all right, hold on.
Both medical questions.
Hold on. Let me get to a few things here.
Hello?
Gretchen?
Yes.
Okay, listen to me, you crackpot. Are you a little bit nutty?
Ooh, yeah, I am.
Yeah, what's going on with you?
Oh, come on. I'm the classic case.
You got a lot of stuff going on, huh?
Yeah.
All right, hold on. I have my left hand on my left side. Where's my appendix? I think it may burst. Is that
on the other side?
Right side?
But your spleen maybe.
Okay, my spleen. I'll put on my spleen. How many kids?
Where were you 10 years ago or 15?
How many kids? I was swinging a hammer and more miserable than you are.
He's laying carpet.
How many kids do you have?
I have none. See, I did the world a favor there.
Oh, good God. Thank goodness, baby. I'm going to send you out a windbreaker.
Okay.
All right, listen. You went to the doctor about the fisting, right?
Yeah, I went and got checked after that because I was having yeast infection.
I see. And was this one of your gentleman friends who wanted to fist you?
He couldn't get an erection, so I guess he had to make up for it. And
I understand. If I had a nickel for every time I fisted a chick because I couldn't get it up, I'd be a rich man right now.
he was a lame.
Okay, so Gretchen, let's just focus on your skin for a second.
Oh, there. Yeah, that's not really a major priority.
Well, that's what you called in about.
Because you mentioned that product, and I was going to use it.
Well,
but
okay, that's why you called in. How about going to a dermatologist and asking him for some help?
You could just go to a general practitioner to start because you haven't done any of the basics. And the mainstay of treatment for acne are still the basics. They're the superficial, the Cleocin T and the erythromycin. They're things you can just put on your skin and use the benzoyl peroxide. And it sounds like in your case that would work just fine.
All right, there, Gretchen.
So what could that be then?
Well, you have persistent yeast infection. You've probably been placed on one. Do you even want to ask?
I didn't even go to the hospital and chain yourself to the vending machine.
Right. Well, it's one of those situations you need to be reexamined, and there are other reasons why yeast infections can persist, and they're not always effectively treated the first time. Probably going over the cotton, the different kinds of clothing.
Baby. Jay?
Okay.
What's up?
You're 20.
Yeah.
Yeah.
I have a question.
All righty.
I had anal sex with this guy.
Mm-hmm.
And we had no condom.
I see.
And I was just trying it out.
Sure.
And it didn't work. I mean,
it didn't work.
He was.
Which side of the penis were you on?
I was on top.
You're on top. So the penis was attached to you or attached to your ass?
To my ass.
I see. So his penis was in your ass?
Yes.
Okay. Should I get a chalkboard out, or are you with me on this one, Bruce?
I'm.
You know where we're at?
He didn't have a condom.
He had no condom, and his penis was in your ass?
No.
I see.
And, we tried it, and...
It didn't work?
It wasn't working, so, I mean...
That's good.
He didn't...
Maybe his hymen hadn't been broken.
He didn't, come in me.
I see.
And I was wondering if there was, any still danger there.
Did he get in you?
No.
But he tried.
We tried.
And,
for a little while.
A while. And why do you think it didn't work?
It hurt, and he was too big.
I see.
The fact that it hurt is not a good thing, okay? Because that area is, it's not quite as elastic as the vaginal entrance. So you're
it is not, and
frequently
thank God.
getting some bleeding, some trauma that you may not even know happened, and there's fluids being released even though he didn't completely ejaculate.
Who was this? Who was this guy?
Some dude that we hook up every now and then.
Okay, so
I see. So it was this dude.
Okay, are you bisexual? Are you gay? What's?
I really don't know.
I'm going with gay. So what happened to you? Anything?
What do you mean? What happened to me?
Any rape or abuse, molestation, anything like that? What turned you gay? I always love that question.
Oh yeah, I'm surprised you don't.
You know of anything, Jay?
Not that I can think of right now. I mean,
God. Okay, so do you have a girlfriend? Also, or are you?
No,
he's gay.
Okay,
all right.
Well,
so
you need to figure out what you're doing. I would, until it sounds like you're pretty confused about everything. Don't pick up guys or hook up with somebody once in a while like this, because you're at risk already for HIV, and you're really. Yeah, and right. Who knows what else. So the question is, did he...
Bruce, your feeling with callers like this is they're going to hell, so why should you help them?
No. What do you mean?
You're kind of a Bible thumper.
No, oh, please.
A little bit, right?
No. No, that doesn't even enter my mind. I'm concerned. I'm concerned about this guy because I think he's...
You know what's kind of weirder than anal sex, male on male for me, is anal sex that goes awry. Anal sex that is unsuccessful. For some reason, it adds a extra level of surrealism to what I think is already a bizarre act. You know what I mean? Like that whole point where you're like trying to get in and you're asking, are you in? And wait a minute, it hurts, and you're back there for a while trying to fish your way around.
Have you ever been accused of being homophobic?
No, that's like, it's like a cop telling you to do a field sobriety test that lasts an hour and 15 minutes. Like he tells you to walk a straight line, but you walk for like a quarter mile. He tells you to do something over and over again. Like it must just get surreal after a certain point.
I hope you're not thinking of future episodes of The Man Show.
You know what I mean? When you're trying to get in a guy's ass and it goes on and goes on and goes on and goes on. No.
Okay, Jay.
All right,
Jay sounds confused.
Jay needs to just chill out for a little bit.
But he's... Let me just...
No,
I just want to tell him to go to the doctor.
He's bisexual. He can hear you, you idiot.
Jay.
What?
Okay, have you seen a doctor since this happened?
No.
Okay, look, do you have a doctor?
Why does he need to go to a doctor?
To be examined.
The guy couldn't get in.
It doesn't matter. He tried to get in. That's enough.
What?
So he didn't have a condom on.
Oh, what's the doctor going to find?
He's going to do a rectal exam.
Really? Well, he didn't do anything. He didn't get in. Jay, how's your anus?
It's fine.
See that?
He needs to go to a doctor to talk to the doctor about the proper use of condoms.
All right, how about... Oh, he doesn't have to talk to a doctor about that. Listen, Jay.
Yeah.
How about you get yourself an HIV test?
Okay.
Through a doctor?
No, just go to a clinic, get an HIV test, and while you're there, have the nurse give you a couple of condoms to take with you, okay?
All right.
All right, get a little lubrication and slow down. All right? Just relax. He's 20. I hadn't been raped anally. I was 22 and a half.
You know what
I mean?
Okay, and no problem since then.
For me?
Yeah.
No?
Okay.
A-hole's just fine. Ask Drew. He was in here last Sunday. Ask him how my ass was working. Working like a Swiss timepiece.
Suspicious.
Jason.
Hello?
Jason, you're 20.
Yeah, what's up?
Yeah, you know what night it is, Jason? It's Sunday weirdo night.
I guess so, man.
Yeah, a lot of people having difficulty forming questions, a lot of screwed up older broads, a lot of speed freaks.
Yeah.
Yeah. Let's not add to that, Jason. Let's ask our question and get right through this one.
Okay, I've been smoking pot for about 2 years now.
I see.
Every day.
Uh-huh.
And I just quit about a week ago.
Mm-hmm.
So I was wondering how long it's going to take before, I get all the side effects go away.
Why'd you quit?
I'm taking really hard courses this semester.
I see. In junior college or regular college?
Regular college.
Wow. Which college?
Cal State Long Beach.
That's kind of a junior college. Hey, can I have your bong?
Sure.
You done with it?
Yeah.
Probably got a lot of resins in there.
Oh, yeah.
Yeah.
All right, so Jason, what kind of symptoms are you having now? What side effects are you talking about?
Well, I started, forgetting a lot of things. Like I would meet a girl at a party and 2 minutes after she told me her name, I couldn't remember it anymore and things like that.
Hey, we had Janine Garofalo on this show 3 times. She came in 6 months later. I introduced myself to her. Don't worry about it.
Okay. When you're using marijuana for a long period of time like that, the way you remembered stuff while you were using it, your brain is not used to not having it there, so you're going to have trouble remembering stuff for a while. It doesn't get out of your system. You're smoking it that much for 2 years. It'll take several months for it to completely get out of your system. And the other thing I'm concerned about, people that started when you're 18, smoking every day, there's usually something they're self-medicating for. So you may develop some anxiety symptoms, depression may come out. Some people have an underlying bipolar disorder. So the thing is to be aware that you may have been self-medicating, and I would talk to, well...
Bruce, I'm falling asleep here. I know, let's get to it. What is it?
Well... When the effects wear off, it's going to take them several months to know, but frequently people have psychiatric things that show up after they quit smoking pot. Let me talk to them.
No, that's plenty. Plenty. Tell them to go to PA or something. Or
well, I can't. Can I refer them to a doctor? I don't like
doctor? A specific doctor?
No.
Just tell them, go to MA. Oh, you're not smoking. Give it another few weeks. It'll get out of your system. There you go. Hey, good times. Chris?
Yeah.
You're 16.
Yeah.
What's up?
My girlfriend's pregnant. Or my ex-girlfriend's pregnant.
I see. How old is she?
18.
I see. And what's up?
I told her that I'd give her $300 a month for child support.
Wow.
And she wants to take me to court.
Jesus, you got to sell a lot of pot to make an extra $300 a month, don't you?
Actually, I'm working at McDonald's.
Wait a minute. You don't make $300 a month after taxes at McDonald's as it is.
I'm making around $500 a month at McDonald's.
$500 a month?
Yeah.
What did you do? Invent some new burger or something?
No, I get paid like $6 an hour.
The McStoner? $6 an hour?
Yeah.
This guy sounds depressed.
Holy Christ. Yeah, let me tell you something, Chris. When I was 16, I worked at the Studio City McDonald's. I made $2.35 an hour.
How long ago was that?
Well, when I was 16, 20 years. Yeah. Time to lean, time to clean. That's what the sign said.
How old's your girlfriend?
She's 18.
Okay, so you're not getting along at this point on any level? You're not communicating real well?
Well, I was planning on breaking up with her before she told me she was pregnant.
Are you working full time?
I'm not supposed to be, but I am.
I see.
I'm working 4 days for 40 hours a week.
Jesus, you're going to be managing that place another 6 months.
Yeah. So are you depressed? Are you anxious? What's going on with your mood? I mean, it sounds like a very stressful situation.
Oh, I haven't had a cigarette in a little bit, so...
Oh, well, then
I see. Hey, Chris?
Yeah.
All right, but so what's the question? Your girlfriend wants to take you to court?
Yeah, I'm not exactly sure what I should do about that.
Well, if she wants to take you to court, you kind of have to go.
Yeah,
Right.
but, like, what would happen or what could happen?
Okay, here's what I think you ought to do. Where are you calling from?
I'm calling from Maryland.
Oh, Maryland, okay. I got a buddy out there as a lawyer. He specializes in this.
Yeah, right.
No. You're in the Bethesda area?
Not quite.
Okay, because he's out of Bethesda. Let me give you his home number. No.
Okay.
Here's what you need to do. There are groups, just recently these groups have sprung up. These are sort of fathers advocates, these rights for fathers. Now, most of these things that they deal with, would you shut up, Bruce? Most of the things they deal with are custody battles. This is not a custody battle. But I bet if you talk to one of these guys, you could figure out what your rights, what your obligations were, what you could look forward to when you went to court. Do you need some kind of low-cost legal counseling? Is there somebody you can talk to, or should you just show up? I mean, you're 16, you're working at a goddamn McDonald's. I don't suspect the judge is going to say that you got to give her $2,200 a month because you don't have it. Do your parents have any money?
Not really.
Okay.
They just got done paying a very large bill for me going to court.
For what?
Selling Adderall.
This is Adderall.
Well, that's how he makes it. That's where he gets the $300 a month.
Selling your own Adderall?
No, it actually was hers.
I see.
Okay, and how old?
You're off to a flying start in life, by the way.
How far along is she?
5 months.
And when did she turn 18?
April, late April.
So she was 18 when you got her pregnant?
Yeah.
Okay, and you're 16. So there's some issues there. I'm not sure if I were her, I'd want to go to court.
Well, hey, Chris, I was telling a young lady who was 16 earlier in the show how to condense the next 15, 16 years of her life and just sort of get it over with. I'm going to see if I can work out a little plan for you.
All right.
If I were you, I'd hit the booze pretty good right now. Hook up with another chick, knock her up, and then move to Florida. I don't know why all these guys end up in Florida, but you move to Florida and you chain smoke and you drink and you end up on working like on a fishing boat, and you meet some new chick who already has 3 kids and she's 8 years older than you are, and you hook up with her, and then your 15-year-old daughter spends the rest of her life trying to find you and wondering why daddy wasn't a part of her life. Now, I'm saying we should just take care of that right now.
Okay.
Can you just move to Florida and start drinking and see if we can meet an older woman with a couple of kids?
Chris,
I've already got the drinking part down.
You got the drinking part.
Are you still drinking?
Not right now, because I got fired from a very nice job for getting drunk.
What job was that?
Your Wiener Schnitzel.
I was working at a camp over in Virginia.
Okay, so have you had the wake-up call yet? You've had some bad things happening recently, but have you learned anything? I mean, you got a lot of wreckage at age 16.
Yeah.
Okay.
And it's great that you want to take responsibility, but you're concerned about going to court. I think that getting some legal counsel wouldn't be a bad idea, but she at age 18 is not going to...
Call up one of those, open the phone book, look for one of those fathers advocacy groups and see if they can point you in some kind of direction.
And go back to school and go to AA.
Go to like AA and find Jesus Christ or Jehovah and just... do something, buddy. You're 16. You got busted for selling Advil. You got canned from your job. You're boozing. You're giving up cigarettes for this week. Jesus Christ, this guy sounds like a Vietnam vet. He doesn't sound like a 16-year-old. What the hell is going on in this country? Nicole?
Hi.
Hey, you're 24. What's up?
Well, for one thing, I hope I don't turn out to be a Sunday weirdo.
You're off to a good start.
Yeah.
Go ahead.
I've been having a sexual relationship with a guy at work for about 3 months now. Actually, I consider him as a boyfriend. But in the past 3 weeks, he's been acting kind of distant. And, I'm kind of nervous here, so.
That's all right.
Go ahead.
Over the weekend, we got together. Of course, no sex, I might add. He says he knows he's...
Wait a minute. No sex on your dad? On your bed?
I might add, this weekend, we didn't do nothing. He says he has been distant.
She's on her period? Is that it? No sex on her? I didn't hear what she said. Did you?
No, but I don't think it's a key.
Is she on the rag? What'd she say? No sex on my pad? No sex on my pad?
In my pad.
In my pad? Does she mean maxi pad? I'm sticking with the period thing. What do you think? Why do you think no sex?
I don't know.
Nicole?
You guys are embarrassing me.
No sex what?
No sex, I might add.
I might add. Okay.
Oh, I might add.
Okay.
I see.
Trying to be proper here.
I see.
Oh, boy.
You're doing fine.
All right, so he was over, no sex.
Okay. Well, after, we went out, we sat in the car for a little while, and he said that, he knows he has been distant with me, and he says he hasn't been completely honest with me, and he said the truth is, he's falling for me, and I'm thinking, okay, there's something wrong with me. But he's like, no, he says, I have herpes.
And how does he know you have herpes?
I don't know. He told me.
Oh, I see. Right.
I did not know that. Actually, I've fallen for him, too. I guess in the beginning, he just thinking, oh, okay, a girl, and I don't know.
Okay, he has genital herpes.
Yes.
All right, so he's probably having some kind of outbreak now, right?
Okay, an outbreak, okay. How long does one of them usually last? I've got so many questions about it.
All right, I'll answer all your questions.
Okay.
Genital herpes outbreak, 14 to 16 months. is usually how long the lesions.
Okay, now he
And so
told
it's
me
like,
he's had him for about 12 years. He's 36 years of age now.
I see.
And he said he said that many times if he's had these outbreaks, he can count on both of his hands or he can count on one hand.
Right.
I mean,
right. Except for he has 19 fingers on each hand.
Yeah, they can, Adam was sort of joking, they usually don't last that long, but about a third of people who have, that are exposed and have herpes, they'll only have minor or no recurrences. A third have them every once in a while, and then
He showed it to me, and it's like on the underside of his penis.
Right.
And it's just a one little red dot.
Okay,
Can I tell you how glad I am that I wasn't there in that car when he pulled out his herpetic penis and showed it to you?
I did not say a word for actually till the next day. I mean, I blew up. I'm like, oh my gosh.
I had a date try to pull that maneuver on me once. I went at it with the cigarette lighter.
Want to show you his penis?
Yeah,
Okay.
right at it.
So what are you upset at? First of all, the guy's probably had it as long as he said he has.
Right.
And unfortunately, most people think, well, if I can't see anything there, I can't give it to somebody else. But you can't just look and know. So he should have told you earlier, and he didn't. So you have been exposed to it, and you may or may not develop it. But this doesn't mean that he's been unfaithful or that he's...
No. She's freaked out. Here's the deal, because we got to go to break. He likes you. That's the good news. He's got the herpes. A lot of people do. You can work around it. Go on the internet, punch up herpes or something, and find out some information on it. Educate yourself. Figure out what his cycles are, his rhythms are. Put the condom on. Talk to a doctor.
He'll take the antivirals.
Not Dr. Bruce. He'll take his antivirals, and you guys will live long and prosper.
Well, let's make sure that's what she's upset about.
That's what it is. She likes the guy.
Right.
And she's glad he likes her.
But she was very angry today, she said.
He's very upfront, though. He pulled the penis out right in the car and showed her the lesion. It's great. He's like, yeah, hold on, let me get this out. Okay. And, turn on the dome light in the Chevette so I can show you the lesion.
It's not syphilis and it's not gonorrhea.
Is that? No. Those are my balls. Yeah, no, that just above it, the thing looks like it's it? Yeah, that's the herpes. Yeah, look at come on, talk to it, make friends. Introduce yourself. All right, we're going to take a little break. Dr. Bruce is our guest tonight. He never disappoints either. Filling in for Dr. Drew, and we'll be back after this.
LoveLine will be right back. So get your problems ready.
This is LoveLine on Outrageous Talk Radio, 100.7 The Buzz.
Hey! Eating a cookie. LoveLine, I'm going to put 15 pounds on the next 3 days, Dr. Bruce in here.
And then eat some Adderall.
Seriously, can you bring me in some candy? You know what I'm saying? From work?
Oh.
All right, seriously, Bruce.
Yes.
Drew is really uptight about dipping into the sample drawer and bringing me in some goodies. You know, just a little something to take the edge off at night, help me get to sleep. A little Valium. A little Ambien, something like that. Mm-hmm. You bring in something like that?
Yeah.
Well, we won't talk about it over the radio, but could you?
You get the mic off.
Do you have some Valium floating around?
Yeah.
That's what I'm asking.
At
work?
No,
could you
only
get
if I
into
could.
some of that?
I'm surprised Drew hasn't given it to you just to decrease his own anxiety and sitting. I'm keeping it real, yeah.
Can you find some Valium?
No.
I don't even have any? You don't have any?
Don't even have samples.
Not in the car? What do you get samples of as a doctor? Do you get some good stuff?
You can get samples of most anything. I think the Viagra sample lady is tired of handing out Viagra samples.
Her feet have blisters.
Yeah, right.
But what about, forget about Viagra, but what about some nice sleeping pills?
No.
Some industrial strength?
You know, I think the trend these days is towards keeping less of the scheduled medication as samples, but I don't maintain a family practice or an internal medicine office.
Yeah, but you're at the hospital, right?
There's no samples.
You
in a
got the
hospital.
keys to the cabinet,
Hospitals
right?
do not.
No
No,
samples?
the nurses have the keys.
Nurses?
You don't keep samples in a hospital. It's against the rules.
You can't get at anything over there? You can't reach, there's no sort of stray pill bucket you could just reach your hand into, grab a handful, bring it in for me?
Haldol Thorazine, that would actually...
Yeah, how about Thorazine?
Unacceptable.
No?
So I drew over maybe some Neuron or something.
You bring something in.
Tegretol.
Yeah.
See, a typical addict, it doesn't matter. Well, your philosophy doesn't matter as long as it changes the way I feel. You just don't feel comfortable the way you feel. So
No, I feel fine. I just like to feel a little different. That's all.
So, Drew, how about administering you like Tylenol in here or something like that?
Tylenol?
Yeah.
For what?
Whatever. You don't want.
Listen, here's my problem, Bruce. I'm a heavyweight.
Oh.
These guys, these chicks who have like a half a herbal nightcap and pass out in the kitchen. That ain't me.
You're eating a kava plant. You're grazing.
Seriously,
grazing
I take a couple of Vicodin, wash it down with a half bottle of red wine. I don't feel anything.
But the Tylenol and the red wine will kill your liver. So yeah. So just get straight morphine. Don't
straight morphine.
Yeah, not Vicodin.
Okay,
it's got Tylenol.
Where do I get that?
I saved your liver.
All right. Yeah, we got to talk about my liver during the break. Sable,
Yeah.
you're 14.
Yeah.
No Tylenol and booze, bad.
Bad. Even just a glass of booze and a Tylenol. Oh, yeah. That's
bad? I've done that a few times.
Well, there have been people that have sued their physician because they didn't warn them that when they take something like Tylenol with codeine or Vicodin, they shouldn't have a glass of
Vicodin's
wine.
bad, too, with the wine. I told Drew I've done that 100 times. He sits there and laughs. What the hell kind of doctor is he? Thank God Bruce has taken some interest in my liver.
Yeah. The twilight zone of your life. He's assuming you're making these.
Well, back to the point. Quiet down. We'll figure out what I can wash down with booze during the break. Sable?
Yeah.
You're 14?
Yes.
All right.
I want to know what the long-term effects of speed is, and if speed really does make you skinny, because that's what I heard.
Are skeletons skinny? Oh.
You mean when you're dead?
Yeah. No. The
problem. Make a joke in front of our listeners. How dare you?
I know. I apologize,
Bruce.
That was.
Let me ask you about
excuse
speed. Does it make you? Does it just suppress appetite, or does it actually speed up a metabolism?
Speeding up a metabolism is a misnomer. These things like fat burners.
Okay, please answer the goddamn question. Does it just suppress appetite, or does it speed up your metabolism?
It basically just suppresses your appetite.
Okay, just suppresses appetite.
It just suppresses appetite.
Okay, so that's the only way you lose weight on speed. You don't feel like eating.
Yeah, but people are running around,
right,
they're hyper.
Right.
You don't eat, and you're more active,
and you're moving.
You don't sleep.
Right.
Just many things that contribute
You're burning calories, and you ain't eating.
Right.
Okay.
Metabolism's not like a number that you read and you measure when a patient comes in. Oh, your metabolism's up. That's more of but there are people that will take thyroid pills, will take other things. Now, that's something that increases your metabolism. So,
all right.
Anyway, so Sable, the bottom line is methamphetamine or speed, the long-term effects are many. And your heart muscle is affected. It can affect other organs in your body. But what people are getting really concerned about are the long-term effects on brain and brain function. And that's not even talking about the addiction potential. So it's a very addictive substance. Even if you go to a doctor and you get pills to curb your appetite, what they've done is they used to give out things like amphetamines, like speed, in a much lower dose than people abuse in the street. But they've designed drugs that have very little of the addictive effect and very little of the effect that methamphetamine has in the brain. So,
right.
But I want to ask her something. Just say
All
right, do you have friends that are taking it to lose weight? Hello?
She fell asleep 20 minutes
I know.
ago.
Do you have friends that are taking it to lose weight?
Me and one of my friends, we didn't like each other, and this year she lost a bunch of weight during the summer. And then I saw her and I was like, oh, how'd you lose so much weight? She'd go, oh, nothing. Then I found out later that she'd been tweaking a lot. And I was like, what? She'd go, oh, no, I wasn't tweaking. I was like, yeah, but I was like, how'd you lose so much weight? And then
no, that's a big problem in schools today. Listen,
all right, Sable, you'll tweak your mind. Don't do it. Eat right, exercise. It's a long term. You can't. You're 14, for Christ's sake. You can't get a little goddamn exercise. Listen, all you crackpots out there that are 14, 15, 16, you guys should be running around anyway. A 14-year-old, you should be out kicking a soccer ball. You have to sit around and get on Dexatrim and Metabolife and all this other nonsense or speed or whatever it is. You're 14. Join the soccer team and stop eating so much crap.
But when you're 14, your brain doesn't have consequential thinking. So you tell them,
right,
moron, don't do that.
Oh, who cares? Renee?
Okay.
I don't care about
Yeah.
anybody. You're 18.
Yeah.
What's up?
Okay. Well, first I'd like to say hi, Andrew. Hi. Oh shit. Already lost my mind. All right, never mind.
You better go right. See, listen, you didn't pick my question. You went off.
Let me say it was whacked out bitch night on LoveLine.
This is.
Oh, shut up. Renee?
Yeah.
Go right to your question.
Okay. Sorry. All right. Well, I have a kid, right? And his dad is like, he's trying to get back with me and everything. And I really don't want to because I want to get back with my ex-boyfriend. And my ex-boyfriend knows it and everything. I'm not sure what he wants, but he told me he still has feelings for me and everything. And I still love my son's father, but it's not the same. And I asked some of my friends about it and everything, and I asked my mom about it and everything, and they're all like, it's not good, because he's just, I guess you'd have to know him, he's just not a good person.
Well, we'll take your word for it. What's wrong with him?
Well, he's really, can I say asshole?
Okay, is he physically abusive? Is he verbally abusive? Asshole.
He's just like, I don't know, he's been in and out of jail. He's in jail right now.
What's he in jail for?
Okay. Contributing to the delinquency of a minor and corruption of a minor. He took his little sister.
He did what?
He took his little sister and like two of her friends to a hotel party with him. And the cops showed up and
Nice.
he got like 3 or 4 counts of it.
Great. And he was on parole?
He was on probation.
Oh, I see.
And so, like, he got put back in jail for that.
I see. Fantastic. How old is he?
He's going to be 22 in October.
I see. And you have a young son with him?
Yeah, he's 1.5.
Listen. All right, let me say one thing. Forget about this guy who's in the pokey, okay?
Mm-hmm.
He's not for you. Number 2, this young son you have,
yes.
Any crime he commits in the future, I hold you personally responsible. Do you hear me?
Yes.
If he goes out and kills someone, I want you to do time with him.
Okay.
Think that way each and every day you raise him. And all you other horrible parents out there who's a 13, 14-year-old goes up and beats up old people, I want you going in the clink with the kid because you're just as responsible, maybe more, than this young kid. So keep that in mind. I wish we'd just make that a policy in this country and make the parents do just a little more thinking before the kid skated out at 10:30 that night at 13 or 14 years old.
Do you have
Number 2, who's the second guy? The ex-boyfriend.
He's my ex-boyfriend, Sean. He's really great. He's doesn't do drugs. He doesn't do anything wrong. He's actually pretty good. He has
All right.
a job.
Good.
Do you have custody of the kid?
Yeah.
Complete.
Yeah.
No, the guy, he stays with his father in prison 3 days a week, you idiot.
Legally, who has custody? She has to go to court and get... All right. Okay, so you have custody of your kid, and this guy's going to get out of jail. And
Monday, Wednesday, Friday, he goes to Folsom County with Daddy, and then every other Sunday he goes to prison.
I think you still have to go to court and have it...
All right. So, Renee, here's what you need to do. A couple of things. A, you cannot get pregnant again.
I won't. I don't want any more kids.
Good. Sterilize yourself. Do something.
Okay.
Put something up in you and break it off.
I don't think I want to do that.
Okay, why did
well,
you
I'm not
choose?
a doctor.
But what about Renee chose this guy?
Number
You don't
2, don't put all your eggs in the ex-boyfriend basket, but let him know you're available. If he wants to come back, you guys can have a relationship, wear a condom. And don't get hooked up with the prison guy. Okay?
And
do me a favor.
I should tell him because I don't want him to like freak out and hurt himself or anything because he is in jail.
When's he getting out? When's he getting out?
If he doesn't get out in the middle of this month, then he's getting out in 24 months, 2 years, yeah.
Okay, so it's either 4 days or 2 years?
Because I really don't want to hurt his feelings. I don't want to. I don't want to.
Great lawyer. Listen, here's the good news. You may be out day after tomorrow, or you may be in for another 8 years. I don't know.
I don't know. She
Listen,
needs to go to some codependency meetings
do
or something, too.
Don't
Listen,
have any more kids. I don't know what else to do.
she's not going to follow through that she needs some help.
And listen, if you can find your biological dad, kick him in the nuts for me.
Yeah.
Let me just ask real quick. Renee?
He's in the other room sleeping.
Your dad is?
Yeah.
Good. He's at his most vulnerable. Does he sleep on his back?
Yeah.
Good. Right in the nuts.
Look,
He did a horrible job.
Yeah, it sounds like you're going to need a lot of support to stay away from this guy. You need to go to a counselor. You need to go to codependency meetings.
Yeah. Yeah. All right. All of you. Anyone who can hear me, go to a meeting right now. Let's just check in with Kelly. Kelly? Kelly. Hey,
Hello?
wake up.
Yes.
You're 24. What's up?
I have been, it's kind of a serious type of thing. It's not a medical question, but it is very personal, love-related, and I've been together with this guy for over a year now. We've been engaged for 10 months. When I met him, he was a great guy, owned his own business, did his own type of thing. Seemed like he had his stuff together.
Hold on. What was his sign?
I'm sorry, say that again?
His sign?
What's his sign?
Yes.
Aquarius.
I see. Okay. Continue.
I'm a Cap.
I see your Cap. Okay, so you guys are compatible.
Okay, as far as as far as I know, completely compatible. Everything worked out fine. We led a very, positive, healthy relationship.
I see.
Up until about 2 days ago. Actually, was it yesterday? Yesterday, Saturday. And I was on our laptop looking for a job, and I went to actually open up his, his nightstand on his side of the bed looking for a pen. And I stumbled across some pictures of him.
Now, when you say stumbled across, do you mean actually tripped over the pictures or just found them?
Practically.
I see. Okay.
They were out in the open, laying on top of everything else. They weren't tucked away or hidden. They were right there in the very front of his drawer.
Such a Capricorn thing to do.
Okay, and they were pictures of him, basically pornography with him and these very obese women, 200 pounds plus.
Like having intercourse with them?
Yes, more than one, several sets of pictures with all different kinds of women, at least 5 different women. Sometimes in one set it was 2 women with him.
Did you talk to him about it?
Hold on. 2 pictures, and were they all obese? Sort of obviously?
Oh, yeah.
So it wasn't like it was a coincidence that he hooked up with a couple of heavyweights. It was more like he was doing fatty love porn?
Exactly. I couldn't describe it any better way.
Okay, and you're not overweight, he's not overweight.
I am not overweight, no.
You're not?
No, definitely not.
And he's not?
Okay. And he's not, no.
And this is like that novelty porn where guys go at it with huge chicks, and they were like morbidly obese?
Yeah, they're definitely obese.
Okay.
I'm talking explicit, not anything with taste, not anything like beautiful lingerie shots. I'm talking beer bottles, all types of things.
But I'm real fat.
All right, hold on a second there, Kelly. This is the best call we've gotten all month.
Yeah, she's an intelligent person with a serious problem, so hopefully we'll get beyond the
wait a minute.
gutter humor.
Imagine stumbling upon some fat love porn with the okay.
It's
all
not
right.
funny.
This is tantamount to striking a vein of gold in radio. We call this gold talk.
And I'm going to protect Kelly.
Yeah, Anderson knows good radio. He knows we call it gold talk. So we're going to take a little break. We'll be back to mine for a little more gold with Kelly after this.
Back in a minute.
This is LoveLine on Outrageous Talk Radio, 100.7 The Buzz.
Hey, welcome back to LoveLine and Gold Talk. I'm Adam Carolla. That is Dr. Bruce. Dr. Bruce is filling in for Dr. Drew, who allegedly will be speaking in front of Congress. Do they have a cafeteria that he can address them in? he's certainly not going to be on the
cafeteria.
He's not going to be on the floor of Congress, is he?
I've had anal sex.
Quiet down, Drew. Kelly.
Yes.
All right, so you have this man in your life. He was, by all accounts, a wonderful man. Right.
From what I thought.
From what you thought, you're engaged to him. You've been engaged
Correct.
for 10 months.
Correct.
Engaged to be married. I like when people put it that way. And you were looking through a drawer in his nightstand just to get a pen. Just to get a pen.
Right.
Not looking for any fatty porno pictures.
Oh, no.
And you came across pictures of him having sex with obese women.
Correct. Several different sets.
Several different sets.
Settings.
Now, how big?
Several different ways.
How big were these pictures?
How big were these women?
No, were the pictures
The pictures are regular size pictures. They're not, panoramic or anything.
like somebody just took them from a regular camera?
Yeah, exactly.
And
Well, the first ones, it gets worse. There's discs even. There's actually, hard.
So he's into this. This is
But
something.
here's the question. Here's what I'm asking. Were these pictures taken by a professional that looked like it was for publication in a magazine or to be put up on the internet, or is just one of his drunken buddies taking a picture?
I don't know whether they were taken for publication. They don't look that professional, but whether they were posted on the internet or not, that I'm not sure of.
You said you found a disc, stuff on the disc in the computer.
Oh, I found stuff on a disc, yes.
What was there? More of the
When
same?
I went to put the discs actually in the laptop, he started ejecting the discs and snapping them in front of me. He told me that the discs were worse than the pictures, and the pictures were pretty atrocious.
Oh, so you talked to. So what's his story?
Well, actually, before I confronted him, actually what happened was I found the pictures and I found the disc, and I decided I'm going to wait until there's a moment where him and I can talk alone seriously about the situation, because I told him what I did was I confronted him and I said, I found some things out, and I want to talk to you about them, in a couple hours or whenever we have time alone. To ourselves, because I think it's time I get to know
it's
my
painful.
fiancé better.
By the way, this is what I love about women. No man in the history of relationships has ever said in the middle of like a party or something, we'll talk later, but I found something out. I know something. You're in big trouble. We'll talk later. Women love this. They love it.
Right.
And this poor guy's head was swimming and racing for the next 2 hours. So
as you can imagine.
You confronted him with the pictures, and what did he say?
Actually, I didn't say anything about the pictures. What I did was I said, I found something out. I said, and I think it's time you and I talk, because I think it's time I get to know my fiancé a little bit better.
I know, but eventually you confronted him with the pictures.
No, what actually happened was I didn't actually confront him with the pictures. This is where it takes a bizarre twist. Is I said, I think you need to think things for about 10 minutes or so and think if there's anything you need to tell me, because I found something out and I would rather have you tell me rather than me pull it out of you.
And he says there's a bunch of pictures of me get nailed in the ass by black guys.
Actually.
And then you went, holy Christ, I got to check the other nightstand.
This is what happened, though. See, I said, I would rather have you tell me rather than me drag it out of you. So if there's anything that
That's the other thing I love about women, too.
Smart.
Yeah, but why with the games? You got the pictures of him with Bertha. Just pull him out and confront him.
Yeah, in this case, did you think there was something worse?
All right, so what did he do?
Well, what he did was he said there was something, and I said, well, what is it? And I'm being prepared.
Go ahead, baby. Spit it out. Go.
I'm prepared for him to tell me, yes, you found the pictures. Okay, let's talk about it. But instead he tells me, well, last weekend I was with this girl, Megan.
All right, baby. All right.
That's when I went, what? Wait,
Okay.
if there's more?
Okay. See, this is men, this is why you're stupid. And women, this is why you're diabolical. She confronts him on fat chicks. He admits to some affair he had over the weekend.
Exactly.
Hey, all right, listen to me, screwball. Here's the deal. We're out of time. Here's what's got to go on. This guy's flawed. He's screwed up in a major way. And you're screwed up because you thought this guy was great. And you shouldn't have. You really shouldn't have. And there's
played the role.
He didn't play the role. Listen,
I think
this guy's not a great actor. There's something wrong with you, too.
No, there's not.
You
Kelly's
shouldn't-
okay.
No.
Kelly, can you move on?
No, you don't understand. He led a totally different life.
I know.
Yeah,
I know.
guy's a little sociopathic.
It's all over, Kelly. It's
And then
done.
when he went home, it was something totally different, apparently.
It's done.
Are you okay? Are you understand? It's it's over. The relationship's over. You're not depressed. You're not suicidal. You're
Most definitely not, no.
Okay,
you
good.
need to see
You learned a
somebody.
lesson before you got married. Do a better job picking your next guy.
Don't take him back.
Don't go out with sociopaths or salesmen.
Hello. This is your radio. LoveLine will be right back.
Yeah. Just telling Dr. Bruce what's wrong with Dr. Drew and his wife. All right. Let you guys
tell
in
you
on
about my
it
wife.
tomorrow night. Bill Bellamy will be in here tomorrow night, a wonderful young actor.
I'll be back too.
Well, okay, but Bill Bellamy will be here. So until next time, this is Adam Carolla for Dr. Bruce saying mahalo. There's a bunch of pictures of me get nailed in the ass by black guys.
This has been LoveLine. The opinions expressed on this show are not necessarily those of the staff, management, sponsors, or this station. The producer for LoveLine is Ann Wilkins Ingold. LoveLine is a presentation of Westwood One Entertainment.